Hi folks, in the last video I was talking about medications and making sure that's not playing a role in the symptom of bloating. In this video I'm going to talk about some of the broad categories of causes of bloating. In terms of gas, we're talking about gas, there may be an excess gas formation. So for example, we may see that with bacterial overgrowth, fungal overgrowth. We may see that also with lactose intolerance or other types of sugars like fructose intolerance, gluten sensitivity. These are some of the sort of causes of the increased production of gas. Then the other thing would be category would be the problem with the abnormal movement of the bowel. The muscles are weak for some reason, or the nerves are not coordinating to allow the body to expel gas in an easy manner, so it's just accumulating. And there are several functional types of disorders which can cause that, such as IBS, which is one of the well-known ones. There can be gastroparesis, where the muscles of the stomach are not working together and the stomach just sort of bloats up and the muscles are just not functioning. Then there can become mechanical causes that, the gas can't really be expelled very easily because there's some type of blockage in the GI tract. There may be a stricture, there may be some sort of scar tissue in there from maybe previous procedures or operations in the past. In women, there are some other conditions to think about, mainly, hormonal disturbances, especially around times of the period with estrogen, progesterone imbalances. Another disorder called endometriosis, which is basically deposits of uterine tissue go beyond the uterus and they start to attach to the bowel lining. It can cause inflammation, scarring, and it can affect the movement of the bowel. Although we're talking about gas, there are some other conditions which can mimic gaseous bloating, and it's important to make sure we're not missing those. So, a very obvious one would be pregnancy, and hopefully that would be something that a provider would make sure, or a patient might check themselves. There may be fluid accumulation and the cavity of the abdomen. That could be from liver problems, pancreas issues. There's a lot of different reasons for that. And then, God forbid, there could be some type of mass or tumor. Again, a good clinician should be able to differentiate between these with history taking, with a physical exam, and with some simple tests. They should be able to go down a certain pathway to determine if more tests are needed or in which way to go. So basically, those are the categories. Feel free to ask any more questions. Hopefully I can expand on some of these conditions in more detail as we go further along this journey. Thank you for listening. Please like, share, and subscribe if you like this.